Viewer contributions make local programming possible on WNIN. Become a member of WNIN with your contribution so we can continue to make this programming available. Visit WNIN.org and click on the donate button.
Medicare benefits have been in the headlines in recent weeks, and now it's open enrollment time. What do you need to know with the government shutdown, potential premium increases, and other coverage changes? That's next on WNIN Newsmakers. Welcome, I'm Noah Alatza, Chief Communications Officer at the University of Evansville. Medicare open enrollment ends on December 7th this year. Here to talk about the basics of Medicare is Carolyn Connors. She's an options counselor assisting with Medicare at SWIRCA. Carolyn, thanks so much for being with us.
You're welcome.
It's good to see you again. Welcome back.
Thank you.
So first for our viewers at home, what is SWIRCA?
We are a nonprofit agency that serves the elderly and disabled individuals of the community. We do offer options assistance, like what's available to help them. We offer more in-depth assessments for those needing home care services. So in our resource department, we do, at this time of year, we also do a lot of Medicare counseling as Medicaid as well. So a lot of hands-on type of care.
And what is Medicare for people that might not be aware?
Medicare typically is the insurance option for seniors over 65, plus younger people that have been on Social Security disability for at least 2 years. They will move over to Medicare.
A lot of people don't understand the difference, too, between Medicare and Medicaid. Could you help us understand?
Medicare is a federal program that pays for, hospital, doctors, drug costs for those that are 65 and older, and as I said, those on disability. So it's another insurance option, especially for those people that are not eligible, like they're not working anymore, so they don't have group insurance, and they may not qualify for Medicaid, although you can have Medicaid and Medicare.
That's interesting. So who qualifies for Medicare, or who's eligible for it?
Medicare, if you have 10 years of work history, or 40 credits as they call it, then you do get Medicare, especially the hospital, without a buy-in or a pay-in program. You get that for free. Then the other parts of it costs, do have a cost to it.
Sure. Now, can people sign up for Medicare at any time, or is this just during open enrollment? And then how do you sign up for it?
If you're new to Medicare, like you just turned 65, you have a period of 3 months before your 65th birthday, your birthday month, and 3 months after that to sign up for Medicare. During that period, if you don't sign up then, you sign up later, then there could be a small penalty for that. And then that you're confined to, like the first 3 months, January, February, March, you sign up, then that goes into effect July.
How do you sign up? Like, is there a portal you go to? Is it working with someone like yourself, I'm assuming? Like, how would you go about even beginning to sign up or look at it?
If somebody's computer savvy, they can go to Social Security, SSA.gov, and you can begin the steps there to sign up. It's best, you have to create your Social Security login and all that, but that is a way you can start the sign up. You can pick which ones you want to sign up for. If you're totally retired without group insurance, you might need to sign up for both A and B. Then they will do the phone interview, and then they will issue your red, white, and blue card. That's the Medicare card. Now that only covers part of what they want to look at for their continued Medicare coverage. It's only part of it.
And I know we'll get into a little bit more details on that in just a minute. I'm curious though now about this phone call. You talk about this interview, so to speak. What does that entail?
It's basically verifying your work history and that your pay-in,
Gotcha.
some basic information.
So here we are, still in the midst, at least as we speak right now, of a government shutdown. I'm curious how this has impacted Medicare enrollment, or perhaps might be affecting portions of how individuals are enrolling. Have you seen any of that this week or even perhaps in the last couple of weeks related to any impacts?
We haven't really heard details about the shutdown and how that's affect the enrollment. What we have noticed over the period of probably the last year is the longer it takes, especially if you're calling into Social Security, longer wait time on the phone. And of course, they're encouraging everybody to create your account and you can get the questions answered that way. So, and it's much harder to get a personal interview.
And I could imagine, if I'm an older folk who might not be as computer savvy and perhaps might want to call it, and that could perhaps create some challenges if they now are recommending perhaps individuals do it more on the website interface.
Yes.
So, I know that we've seen some states have reported this increase or some of these surprise costs, particularly with Medicare. Are we seeing that here in Indiana, some of these surprise costs? Is that really more of a nationwide thing as well? Or can you speak to some of those costs that might not necessarily be included with the whole deal?
There are surprise costs, and that is nationwide. More so, I would think, from what I've seen and the calls I get, is on the Advantage plans, which you have to be aware of networks. Who is in that plan's network, who is not. And, in all honesty, if somebody's in the hospital, you don't, and you have a lot of doctors coming in, Dr. A, B, C, you don't know, are they all in your plan? Are they just part of the plan? Or if you're referred out by your family doctor to another doctor, it's always beneficial to be aware of who's in the plan, who's not, and what the plan will cover. And if they need prior authorization, those are the prize costs that we hear about. That they denied my mother to stay in the nursing home an extra couple of days. Medicare or the plan denied that now, so now she has to go home, but she still needs help. What do I do?
And what do they do?
There is an appeal process that takes time, but there's one appeal process you can go that, it's like you're supposed to get a decision within 24 hours. We advise them of that. And sometimes they'll come back and say, I want to get my mom's plan changed to a different plan. And we try to help with that.
So speaking of the plans, what are some of the different price ranges for different plans? Like, let's say that you are perhaps wealthy. Could you get the top tier kind of Medicare plan, or let's say you might be lower income? Like, walk me through, like, how is it based on demographics, like your income from when you were working? Like, in layman's terms, what are kind of the different plan options?
There's a wide variety, but the best way to explain it is to explain the different tracks. There's, as we or I explain to new to Medicare people, the first thing you have to decide, you have track 1 and track 2. Track 1 is original Medicare. And they both have A and B on it. You still get the red, white, and blue card, but you have original and you have Advantage plans. The original would be the A and the B. The A, if you have the 10 years of work history, is going to have no cost to it. That's the hospital. The B is the doctors, the labs, basically everything else except the scripts. That will have a cost, and the higher your income, the typical one is $185 a month. That will come out of your Social Security check if you get Social Security. And depending on your single or marital income, it can go up based on that.
Okay.
So, and then after that, there would be, so that's two parts of it. There's 4 parts. The D is the drug plan. Those you can get, I think the lowest one this year is around the $8 figure a month.
Okay.
But then you have the co-pays depending on what medicine you're on. And then the A and the B will cover about 80% of the cost. So you go to the doctor, that B will cover 80%. You go to the hospital, that will cover 80%.
And you're paying the rest out of pocket.
Well, that's where the other options come in.
Okay.
You can get a Medicare supplement, which will cover like Plan G is the best on the market right now. It will cover after you get you meet the deductible of, let's see, $288 a year. This next year, it's only one time a year. After you meet that plan will pay everything else.
Wow.
But the issue with those, they will raise it, or mostly they will raise in price each year. Normally they do. So if you start off with one when you're 65, by the time you're in your 70s or 80s, you could be paying to the high 200s to 300 a month, even more. So that's a good option, but it gets very pricey.
I'm curious too, Carolyn, what happens if you are not drawing Social Security and you want Medicare?
You get a bill quarterly, and you have to pay it quarterly.
Out of pocket, right? Because you're not getting that. I'm just curious, because I know there are some individuals who might be in that bucket.
That's a shocker. We get those calls too. Well, I signed up for Medicare A and B, and now I'm getting a bill for $500. How come? It's because they're not drawing Social Security yet, so you still have to pay.
Wow. And up until, obviously, you get Social Security.
If you get Social Security, it comes off the top.
So if you are, well, then what is your recommendation for, like, if you are still working right now, should you get Medicare? Do you think that it's wise if you are even still working?
We get a lot of those calls too. And as I explained, depending on the situation, if they're still working or their spouse is still working, okay, they can get, whichever one is 65 or older, if they've had 10 years of work history, they can get the Part A, the hospital part, without any cost.
Okay.
It will not cost them anything. But if they have credible insurance through their work or their spouse's work that is credible according to Medicare, they do not have to enroll if they're comfortable with what they have, because when they do enroll in B, they will have a cost associated with it, that $185 a month premium.
So then did you touch on Medicare Advantage?
No,
let's touch on that. What does that all entail?
Well, that's the second track. We talked about the original Medicare. The Medicare Advantage is another option. It's managed care. That's the main thing people need to understand. It's the Part C. It's all the ones all the commercials on TV. 90% of those are for Medicare Advantage plans, which I think there's probably 20 to 30 in our area that are offered. And the same company can offer 5 different versions of an Advantage plan. So you have to, but the advantage to an Advantage, okay, it could be the monthly premium is 0, so you don't have any out-of-pocket costs. And it will include the hospital, the doctors, the drugs, and the extra benefits. That's the, they push that a lot. But it is network-based, so you have to make sure your doctor's in network or the hospital. So you could go into that month, you don't have a cost. Your costs are going to be co-pays as you go to the doctor, as you go to the hospital, as you have your tests. And each one of those, the primary doctor could be zero copay. If you go to a specialist, you'll have a copay. So that's where your costs come into effect, is your copays as you get the treatment. So that would be another option as opposed to the Medicare supplement, another one that could be a better option. Just depends on the individual situation.
And you mentioned all of these different plans, but on the insurance company side, aside from the Medicare Advantage, are there just a variety of different insurance carriers that offer all of these different choices? And can you kind of speak to some of that and what that entails?
Well, as we have people come in, they want to find out what option is best for them. If they have an Advantage, then we will help them search on a Medicare site. It's the only acceptable site that we use because it's the Medicare site. There's a lot of other ones that are out there, but they're not official Medicare. So we will help them search. We will look for, we'll get what their medicines are, what pharmacy they use. We will find out their doctors, and we will put all that information in this website. And so it will filter based upon all of that, and then it will display the best option for them with the doctors that are network that covers all their medications, and then it will show the best price for them. So that's how we help. So then it could be one plan has 5 different options of plans available, but this will help them decide which one could be best for them. And we just present them the information, and then they do with what they want.
Gotcha. So walk me through kind of the new rule for supplements.
Effective next year, it's called the birthday rule. So if you have a Medicare supplement, which is sold by the other companies, that pays the 20% that Medicare A and B doesn't cover. They have just enacted, it's called a birthday rule. Before, if you, let's say Plan G, that's a plan, a lot of people have plan, it's the best on the market right now. It'll pay after you meet your deductible, it will pay the other costs under B. But if you had a company that the price is going up, and you can't afford it anymore, you couldn't necessarily price shop to another company because they may not, if you're a health risk, they may not give you a better price. So this birthday rule it's 60 days around your birthday time. Now they have not defined, is it 30 before, 30 after? We don't know that yet. But they can price shop with other supplement plans. They can buy if they have a G, they can shop for a G with other plans and see if they can get a better price.
Wow.
And that's brand new this year.
And I know the other big thing too, Carolyn, is this fraud that we often see for seniors on the Medicare front. What is that? Do you get a lot of calls about fraud? And what in your experience have you seen?
We just had a call a couple of days ago, and we see this quite a bit. What happens is the senior, somehow they get their phone number, and they call and say, I want to send you a new Medicare card. Can you give me your Medicare number? Now, we've been pushing this information for a long time. The Senior Medicare Patrol at the state level has, and this person did not. But what she said was the person on the other end, they get very pushy when I said no. I wanted to know why she needed it. And they're just very assertive.
Sure.
And if there's a senior that's alone that doesn't really understand, they would. And then what they do, they take that number, they bill fake stuff, and then they put it on the client's record. So it's very important. Do not give out your phone number, your Medicare number, to anybody that calls you. Medicare is not going to call you for it, and Social Security is not going to call you for it, and your doctors already have it. So do not give out that number.
What are the other red flags that you might look for? Just them being pushy, them calling at a weird number, maybe asking for that information.
And they'll say they're with Medicare, but they're not. And this person was very savvy, and she finally just hung up. But she said that the person on the other end was just getting very insistent on me giving that number to them, but they did not. So that was good.
It's a great reminder for everyone. And now I am curious too, Carolyn. I know you mentioned that perhaps you had some people that might be waiting a little bit longer on the phone with Social Security in today's day and age. In your experience and in your expertise, is there any perhaps concerns that you may have or foresee, and not sharing your opinion, but surely from your expert analysis, are there any perhaps concerns that you might see that are already happening or perhaps could happen in the future, whether that be maybe some delayed phone calls, technology concerns, anything that you can put your finger on right now? And I know you can't look into a crystal ball, but I just had to ask the question. I didn't know if you could share a little bit about
I think
perhaps.
the technology is a concern. We have some clients, even those coming on Medicare now, that aren't comfortable with the computer, and they, and we get the calls all the time. I'm new to Medicare and I don't have a clue what I'm doing. I really need somebody. And we're not there we don't sell them anything.
Right.
We just present the information, unbiased, and help them choose. So you see technology, if they're not used to navigating the system, it can get, they have improved on the Medicare site. There's a place now you can put your doctors in, so it'll filter based on that too, and your pharmacy and your medication. But if you're still not used to click that button here, it's still so.
Well, and what is the number one call or the number one concern that people are calling you about? Like do you have something that just sticks out? Like what are people calling you most concerned about that they may need help with? Is it just that ability to understand it, or?
Well, right now it's all open enrollment.
Sure.
I need somebody to help me check for next year. And so, but if we look at all 12 months, I'd say it's mainly new to Medicare. I need somebody to break this down for me and explain what my options are. Because you can't, TV just doesn't get it, you know. And I always tell them, you really can't listen to that, because you're not getting the whole picture there. So we get that, like the new to Medicare, it extremely, I think, very confusing for them.
What's your biggest piece of advice for people at home who might be watching? If you
Okay.
could leave them with one thing.
In this time of year, you really, 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 really need to check the plan you have for next year. As we have seen a lot of changes, some plans have dropped. And when they do, we don't want to offer that drug plan for next year. They will send them a letter and say, well, the one I had, it was $20 last year, and it's jumping to $70 a month. Big change, And so
Right.
she read her mail, which is good, and we helped her select another plan. So they will notify them when there's been a change. We've seen some plans drop. We're not doing it. We're out of that
Wow.
market.
Wow.
So they need to check their mail, read the mail, check the plan, and if they can't, and unfortunately, we're booked up, but they can go, 1-800-Medicare. There's people there that will help them. But don't just assume that if your plan this year covers your drugs, you can't really assume that that's the same for next year. So they have to check their pharmacy and their doctors just to make sure that all of their items are covered.
In layman's term, why does it change like every year?
Ooh.
A variety of reasons.
It probably is. I think
Okay.
that's way above me being able to explain it.
Well, okay, before we leave you, Carolyn, where can more people find information then about an enrollment and open enrollment that we're on right now? Where can they go?
I would suggest right now, like I say, we are booked up. We can still do new Medicare appointments. We always do those year round. But I would say right now, if they don't have an insurance agent that they're comfortable with, that is after their best interest, the next best thing would be to call Medicare.gov.
Okay. Carolyn Connors from SWIRCA, thank you so much for your expertise and time. We always appreciate you joining us.
Not a problem. Thank you.
Thanks to our guest for joining us to explain about Medicare enrollment. I'm Noah Alatza, Chief Communications Officer at the University of Evansville. Thanks for watching WNIN Newsmakers.